Okay, Pahrump, well, welcome back. This is the last half of the show. I'm Dr. Michael Reiner, the host of the show, Independent Doctors of Pahrump. And thank you for tuning in. Tonight we're discussing sleep apnea and some other associated symptoms associated with that. Hopefully you've caught the first 30 minutes of the show, and we've been using some slides to help demonstrate it. Here we're going into the diagnosing of sleep apnea, and with that we'll go back to the slide that we brought up right before break, and I'm hoping that you can see that this is an actual patient who actually had the sleep apnea test, and it's a little bitty device they wear on their finger at home, and hopefully you can see me moving that mouse on the screen or that pointer, and you can see that this number right here is representing 90% saturations, okay? That is the amount of oxygen, 100% being supersaturated, 90%, and right below that line is the number 88. When you fall below 88%, as this person did pretty dramatically for a prolonged, this is the timing section of this this test. This clock is a continuous clock running all night long, as you see me move the mouse here. Falling below this segment right here, falling below here. This patient actually fell into some very dangerous levels of low oxygen while they were sleeping, and their body has a natural alarm that wakes them up and does not allow them to stay at that level for a long period of time. But the fact is that they just don't get a restful sleep because they don't have a chance to go through the 4 stages of sleep into what they call REM sleep. This next person below here is same issue, 90%, which is this number right here. I don't know how well you can see that, but that's 95, 100, 95, 90. They fall below 90% almost, I would say, at least 20 to 30% of the nighttime of their sleeping effort. And this is a very abnormal sleeping effort. The object is to stay above this level, above 90%. One of the things that we're going to talk about now is basically the treatment of sleep apnea. We've diagnosed it with this. The person had symptoms. They've come into the office. We've ordered that test, and now we're going into what we might do to treat them. Now, I'm definitely, if you're my patient and you have that level of dysfunction in your nocturnal oxygenation or saturations, I'm going to put you on oxygen as soon as I possibly can, while we try to encourage some of what we're going to go into the next slide, which is lifestyle changes. And what we're going to talk about is obviously losing weight. That's probably the most important thing. And once I place you on oxygen and we correct the situation, as we're going to show you later in the slides, what happens when you get placed on oxygen, some of this actually becomes a foregone conclusion. You actually sleep and you're very well rested through the night. So therefore you have more energy and you feel like doing more things, and the weight loss starts to come out of that. And as you start to lose weight, you just start to feel better. It actually starts to build momentum. And that momentum is a positive momentum. One of the things we can do is we can also avoid alcohol, and we can avoid muscle relaxants. Why are muscle relaxants important? Well, muscle relaxants actually, they relax your muscles. And what do you need your muscles for? Well, obviously to breathe, but you also have a bunch of muscles in your throat that help hold your airways open. So if they're relaxed, and they're more likely to fall back in the back of your throat, you're going to develop obstructive sleep apnea. And Medicare has actually advised us as physicians and some of the other healthcare providers that muscle relaxants in the elderly are a very dangerous drug. They're actually trying to eliminate those from being prescribed to elderly people, mainly with the risk of fall and other issues. But reducing pain medications. If you have pain medications along with muscle relaxants like a bad back and things of that nature, nighttime may not be the time to take the muscle relaxant because it's actually going to make things worse with regards to sleep apnea. I would prefer you take an anti-inflammatory to reduce the swelling in your back, but that does not seem to interfere with your breathing. We also might look at, again, decreasing pain medications. We're going to look at quitting smoking. One of those things that's really important is that smoking already reduces your saturations and oxygenation. I mean, people who smoke have carbon monoxide in their system. Their skin looks nice and bright and red, but carbon monoxide does not deliver oxygen to your vital organs and tissues. And a response to being smoking and having sleep apnea. In fact, this is one of the ways I might actually pick it up in patients is I'm looking to a patient who just comes in for a routine exam. We get their blood work, and all of a sudden I notice their blood counts are elevated. They have what they call polycythemia, too many red blood cells. So there's a good reason for that. Number one, there you have secondary polycythemia, secondary to low oxygen from smoking and carbon monoxide, or maybe they don't smoke and they have sleep apnea. And they've had this desaturation event where, you know, it's like they were living at 8,000 feet up in the mountains where the oxygen concentrations are lower. Your body tries to respond by making more red blood cells. So basically, you know, that's just one of the things that I might pick up as a result of your physical exam and get that changed. Also, again, quitting smoking, obviously not to mention the facts of what it does to the risk of heart disease, heart attacks. I mean, there's just so many things. I mean, you know, if you smoke and if you're on pain medication, if you're on sleeping medications, you're just asking to develop sleep apnea and asking to have problems. Make sure you mention it to your provider that you are tired and you are having those troubles, and hopefully they'll pick up on it. Next thing on that slide would be the sleeping at 30 degrees elevation. This might be a way for you to actually reduce some of the swelling in your tissues. You know, if you were to take a 2x4 and cut it in a small block and put your head of your bed under it and elevate it just 2 inches, and then if you tolerate that, try and go to 4 inches, that decrease in blood flow or pulling that blood down by a gravity method might help to reduce some of the swelling in your sinus tissues and things of that nature. Also, one of the over-the-counter products, Breathe Right nasal strips, can be very helpful for those people who are suffering allergies and nasal congestion. Putting those on and elevating the head of your bed can be very helpful for a lot of reasons. One, decreasing gastroesophageal reflux is very important too, as a cause for choking at night, waking you up, as a cause for even COPD is related to too much reflux. And so those are the basic treatments. Let's go into the next slide, which is we're going to talk a little bit about the oral supplement. Well, actually, again, we talked about supplemental oxygen. If you do have it, that's the first place I'm going to go. And then after I place you on nasal oxygen, I'm going to repeat your pulse ox test shortly thereafter in 1 to 2 weeks to see how you have responded to the oxygen therapy. In addition to that, I'll show you a slide where it didn't work, and then we can see what that entails. So if you respond to it, that's where we keep you, and you're good to go. Hopefully you, again, see the improvement, you lose weight, you get a better diet, you do all the things you need to do to continue that positive momentum rather than lose the momentum. One of the things that you can find on the over-the-counter is basically, I think it's a sleep aid. It's an oral aid where it actually juts your jaw out a little bit and extends your jaw. That might be something, because it is, if you were to take a profile, it's your basically soft palate and your throat occluding your airway, jutting your jaw forward may be a very useful tool. And sometimes some of your dentists and some of your other people actually have and can make an appliance to help you open up your airway and extend that. Then we're going to talk a little bit about CPAP, which we talked a lot about last time. Those are masks, and hopefully that's not the route you have to go. And then there's often surgery, which is something that is always a last resort. But sometimes if you're not responding to, a CPAP, if you're not responding to oxygen, if you're not doing those, then surgery may be a necessary evil. So with that, let's go to this next slide, which basically is going to show what would happen to a person who I place them on oxygen as the first order of treatment, and then I repeat that pulmonary, or I repeat that pulse ox study 2 weeks later, and we can see from this particular, these were the same two people that you saw previously. You saw the first slide, and let me go back to that because I moved that. But anyway, you can see that just pure oxygen at 2 liters a minute allowed this particular person to stay above the 90%. So we're going to go to break right now, and when we come back, I'm going to go into more detail on that particular slide and others. And thank you again for tuning in tonight.